those cardiac markers are positive, the myocardial infarction in the absence of ST elevation will be what type? Non-STEMI. Okay, but just to remind you too that sometimes STEMI may present with the absence of Q wave, and non-STEMI may present with the presence of Q wave. But this is not so important. The first part, up to here, to the myocardial infarction, is what you should remember. And here is presented the changes in the ST segment in case of acute STEMI myocardial infarction. Remember that form of the ST segment. Look, it looks like a banner on the wind. It looks like the back of a cat which is trying to frighten you. Look at this form. It's specific for myocardial ischemia, and especially the case of acute myocardial infarction. And this is how it changes with time, how it evolves since the beginning of the complaints. A few words about the left bundle branch block. The most important thing is this, which is bolded, that it obscures ischemic changes on the ECG. That's why when we detect left bundle branch block, we stop reading and looking for other changes on the ECG. To look for signs of ischemia or left ventricle hypertrophy. Here is the left bundle branch block with its specific changes. The QRS, left bundle branch block, complete, of course, should be more than 0.12 seconds, prolongated, and those specific also changes in the left leads with often notched top of the R peak. And once again, the apparently prolongated QRS complex, in this case, due to the enlarged S deflection, predominantly. And now let's have a look at the left ventricle hypertrophy. Left bundle branch block, left ventricle hypertrophy. The QRS complex in left ventricle hypertrophy could be prolongated, but not to the extent which covers the criteria of left bundle branch block. And those specific changes in lead 1, AVL, V5, V6 that we find in left bundle branch block, in case of left ventricle hypertrophy, are missing. And something else